Thus far, I've talked about what viruses are, and I've talked about what viruses do, and I've talked about the coronavirus slash COVID-19 from that context and that perspective. But what are the actual clinical symptoms and considerations? We're going to talk about that in this video. Welcome back to my channel. My name is Dr. Anwar Youssef Dunbar, and this is Big Discussions 76, Science and Technology. And I might do this as a simulcast where I put this up on my original channel as well, because I think people need to know this information based upon what's going on. And this, this information needs to really get out, so people can know if they have the virus and if they have the coronavirus, and what to do if they get it. So before I left DC, I guess, no, actually, this article says 4 days ago. So sometimes when I open up Microsoft Edge on my laptop, MSN comes up with a slew of articles. And so an article came up entitled, "This is what happens to your body when you get the coronavirus." So that article, this article is going to be the basis for this video. And the author of the article is named Amelia Palusek. I think I pronounced that correctly. I'm not sure if I said this at the beginning of this video, but please like this video, please share it, and please subscribe to my channel. So this article is entitled, "This is what happens to your body when you get coronavirus." And once again, it's by Amelia Palusek. This is from 4 days ago. So I'm gonna do like Aaron Clary, one of my favorite content creators, America's Big Brother, and Captain Capitalism. And I'm gonna read from my screen over here, but just the main points. This is one of those articles. It's a slideshow, so it's not an article where you just read from top to bottom. You have to click and slide the pictures and read the captions. So you're going to hear a little bit of clicking in this video. And I'm just going to go over the main points. I'm going to leave the article in the description box below so you can read it for yourself. It's a pretty good article. So this is what happens to your body when you get coronavirus. The first thing is it enters your body. So the virus has to get inside your body. And this says the virus primarily affects the respiratory system and is transferred between humans by airborne mechanisms like coughing or sneezing. So be careful if you're around someone who's coughing or sneezing. And this is why people are wearing the surgical masks. Or be careful of contaminated surfaces, doorknobs, things touched with the hands, and then rubbing your face. Be careful of transferring things to your face. See, it attacks the human body in 3 phases. Viral replication. See my previous videos to, understand what that means. Viral replication. Let's see, then immune hyperactivity and pulmonary destruction. So it seems to exact damage, or it seems to attack the lung region and the respiratory tract. That makes sense based upon what we've been hearing about more senior people being vulnerable, particularly those with respiratory conditions and immune conditions already. Let's see. So that's what happens when it first enters your body. So in the beginning, you might feel nothing. So there are a lot of people who are walking around who have been infected with the virus who don't know because they're not feeling anything. At the beginning of the infection, people produce a large quantity of the virus. So that's the viral replication. The incubation time is between 2 and 14 days. So again, the incubation time is between 2 and 14 days, with an average of 5 days. During this time, infected people do not show any symptoms, but they contribute to the spread of the virus without even realizing it. Moreover, it is proved that some people may be asymptomatic, but they are still able to infect others. So there are, right now, or this weekend, there were a whole bunch of Gen Zers down at the beach partying, and they weren't worried about contracting the virus or being infected with the virus because they felt like older people were more susceptible. They felt like older people were more susceptible. Well, the danger is, even if those Gen Zers did not develop symptoms themselves, they could pass it on to those baby boomers when they come back. So just because you don't have symptoms doesn't mean you don't have it. It doesn't mean you can't pass it on to someone else. So what it does once inside your body. The virus infects the cells in the respiratory tract, so the lungs, the nasal passage down to the terminal airways. The virus infects the cells in the respiratory tract, taking over the cell's functions, allowing the virus to replicate and then spread from cell to cell. Again, go back to my video. In mild cases, the body's immune system helps to limit the spread of the virus within the body. That's when a fever may set in to combat the infection. In more severe cases, the virus is spread more and can lead to a cytokine storm where the immune system is highly stimulated. So cytokines are what are cytokines? What's a quick definition for cytokines? Those are signaling molecules between the cells of the immune system. So you'll see a cascade or a mass activation of the immune system. Those are cytokines. I believe the interleukins are cytokines. Let's see, here's an ad. Then you can't breathe. The infection can lead to the problems of breathing difficulties from the bronchioles constricting and limiting airflow. You might cough as a result or feel a shortness of breath. Depending on your health, it could get worse, much worse. There are 3 patterns presented with COVID-19. It usually begins with mild upper respiratory illness followed by non-life-threatening pneumonia. If you get pneumonia, that's bad because you have microbes in your lung and your lungs can fill up with fluid. That's called edema. After about 7 days, it can progress to severe pneumonia with acute respiratory distress syndrome, when the patient may require life support. So again, when you have pneumonia, your body's going to have a hard time exchanging oxygen for carbon dioxide with the atmosphere. So you may suffocate. People with pneumonia, they suffocate because there's fluid in the lungs, and that inhibits gas exchange. They are unable to get enough oxygen into the bloodstream, reducing the body's ability to take on oxygen and remove carbon dioxide, which in most cases causes death. About 1 out of 6 people who contract COVID-19 becomes seriously ill and develop difficulty breathing. If you have an underlying condition, your body has a harder time fighting the virus. So again, people with an underlying condition have a hard time fighting off the viral infection. People with underlying conditions such as cardiovascular problems, high blood pressure, diabetes, cancer, and immunosuppressed patients and older people are more likely to develop a serious illness. And these are all doctors saying this in this article. Eventually, with good care and good luck, your body heals. Don't panic, says Dr. Lenland, one of the doctors in this quoted in this article. Most cases are minor, and even the more moderate cases will be fine. The majority of deaths are in the elderly or those with other underlying conditions, including hypertension and diabetes. I didn't know that about the hypertension and the diabetes, by the way, before reading this. What to do if you feel like you have it? Okay, social distancing. Here we go. Anyone experiencing flu-like symptoms, high temperature, a new continuous cough, or shortness of breath should stay at home and self-isolate immediately. People with mild symptoms are able to recover at home. I just published a piece on my blog, by the way, about helping people who are self-isolating, because self-isolating actually is not healthy, because we are humans are social creatures. So people who are self-isolating in some instances need some extra care or intervention from someone, or just someone checking on them in some way. So if you're going to self-isolate, make sure you drink plenty of fluids, proper hydration. Don't take anti-inflammatory drugs such as ibuprofen. There are reports that those exacerbate the condition. Take Tylenol instead. Separate yourself from other people at home as much as possible, and do not share personal household items such as cups, plates, drinking glasses, towels, or bedding. You should stay in one room and use a separate bathroom. Wash your hands very often. You should also restrict contact with pets and animals. Limit contact with animals. By the way, my brother actually asked a question yesterday when some of us were together, and that's what role are pets playing in this coronavirus outbreak? Are they going to be infected as well? Are the pets carrying the coronavirus? Are the pets, are they transferring it to us? That's just something that hasn't been discussed quite a bit. If you're a pet owner, and even if you're not a pet owner, what role are pets playing in this? Anyway, if you need to leave home, make sure you wear a face mask and you keep your distance from other people. Remember that you may only experience mild symptoms and you may recover quickly, but you may infect other people. Let's see, here's another advertisement. If your symptoms worsen. If your symptoms are worsening, for example, if you have difficulty breathing, seek medical care immediately. Don't go to the hospital or doctor's offices. Call ahead and tell them your symptoms. They will tell you what to do. You can leave home after at least 7 days have passed since your first symptoms appeared, and you have no fever for a minimum of 72 hours without the use of medicine that reduces fever, and all other symptoms have improved, such as cough or shortness of breath. How to prevent infection in the first place. Try to avoid contact with others. Keep distance between you and others if you need to be in a public space. Wash your hands and avoid touching your face with your hands. Disinfect surfaces where others may have touched, and also try to stay healthy. Eat well, get rest, and try not to stress. Keep your immune system strong and healthy. The novel coronavirus is just that. The novel coronavirus is just that, new, which means the world's population has no immunity. Okay. Stay inside to keep you and everyone else happy and healthy, and your body will thank you. Okay. So that's the article. I'm going to leave that article in the description box below. And that's more of the clinical side. These are the symptoms. These are people who should look out for the virus, and people who are more susceptible to infection, and these are steps you should take if you feel like you have it. So I'm going to stop this video here. Please let me know if you have any questions or comments in the comments section below. Please like this video, please share it, and please subscribe to my channel. And as always remember that your attitude determines your altitude. Take care, and I will talk to you the next time. Bye-bye.